Hello, everyone. We would like to welcome you to Team Serve. I am Jonette Biebesheimer, biochemist and lead research scientist for Dr. EMF.
And I am Dr. Russell John Court, lead clinician of Dr. EMF. We've been a part of MicroDaily for the past 7 years, and we've had the honor to have worked closely with Dr. Kedar Prasad.
Together, we are your leaders of Team Serve and are happy to assist you in any way we can. We will be hosting weekly calls and trainings to help educate and equip you in building your business.
But first, I must read a protective disclaimer. These statements and comments have not been evaluated by the Food and Drug Administration. This information is for educational purposes only. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address the deficiencies and provide our bodies with the nutrition we are lacking.
All right, welcome everybody to this Optimal Longevity series. My name is Jonette Biebesheimer. I'm the lead researcher for Dr. EMF, and I'm also here with one of my co-hosts tonight, Dolores Beiersdorf. We're actually in her beautiful home in Edwards, Missouri. And I'd like to also introduce my co-host, Dr. Russell John Court, who's out on the veranda in Edwards, Missouri. And we
have me on the porch.
Yes, we have him on the porch. But Dr. Court is the lead clinician of Dr. EMF. He's an author, speaker, and he has been in practice for over 35 years, brain rehab. And he's also on the faculty of the Sleep Balance Academy. And he is my co-host tonight. So welcome, Dr. Court.
Thank you.
Very good. And all right, and I'd like to introduce our very special guest tonight, which is Dr. Kedar Prasad. So let's get up his accolades real quick. Welcome, Dr. Prasad.
You look amazing after being back from Hawaii. You're so tan.
So tanned, yeah. That's the natural one.
Lots of melanin in that skin.
Yeah, that do it. Even my granddaughter doesn't get a tan. They likes regular white guys like you.
Well, Dr. Court and I have just traveled 16 hours to be with our very good friends, Dolores Beiersdorf, and here in her farm in Edwards, Missouri. But I'm going to go ahead, since I don't have your photo up right now. Well, Dr. He's up, but I mean his accolades, which are extensive. So he is the first radiation PhD. He also was a professor and a director of vitamins and cancer at the University of Colorado Medical School, Denver, for over 30 years. This is all from memory, Dr. Prasad, so we're going to see how it's
That's okay.
He was a member of the prestigious Royal Society of London. He was the president of the nutrition, help me with this, Dr. Prasad, and cancer.
The International Society of Cancer and Nutrition. Yeah. And then he also...
Hang on, I got it. From 1992 to 2000. Okay, I know this. He was on the Nobel Prize Committee for Medicine, and since 1982, he has had lots of research, but some of it was even funded by NIH and supported by NIH. He has authored over 26 and co-authored over 26 books in radiobiology, neurodegeneration diseases, nutrition, diabetes, and cancer. He's been published in over 260 times in peer-reviewed journals and very prestigious journals such as Nature, and I read them all the time, as latest work on dementia and aging and telomeres. So he's now an expert of the aging space also, and he just finished his last book being submitted on
the diabetes.
On diabetes.
Yes.
So welcome, Dr. Prasad.
Thank you, Jonette, for your kind introduction.
And he just got back from Hawaii on vacation.
Yes.
So this is the second part of the Optimal Longevity series on nutrients and the gut microbiome. And if you did not get to see the first part, it was actually, you can actually see it on YouTube on Team Serve, and you can watch the part 1, where we actually went over Dr. Prasad's education. We went over his postdoc, congressional funding for the one formulation that has 24 million in research, 14 clinical studies, and it has many patents, but one of the patents is actually on the treatment for diabetes mellitus off of one formulation. So we went over that last week. We also talked about micronutrient misconceptions, and that is from some of his textbooks, which are really important. We then also got to hear about his active lifestyle. So we got to learn more about him. He loves volleyball, and he was very competitive. He loves tennis, and he loves his family, and he stops working at 5. So we learned about that part of his life separate from the research. But then now I did an interview like I'm going to do with you later on our goodie series, which are people that are over 70 that are amazing benefits that are on your product. And so I got to interview Dr. Prasad last week, which was so fun. But we got to hear about his lifestyle, what time he gets up in the morning to do stretching at 5:30 in the morning, and that he's very consistent on his products. And how long have you taken your formulation, Dr. Prasad?
Forever. I mean, since before even it was given to Engage Global, because I developed, and we had a laboratory in California, and so they were all there, and myself and my colleague were taking, even though we tested by the time, but nobody was buying it until Engage Global came, or PMC came, but it was not good company that went under.
So this one formulation you've been taking for many years, and so this is about
the basic one,
is about optimal longevity. And one of the things that, talking about this, some of the things that are the most important are being able to walk,
exactly,
talk, think, cognition. And so for everybody on this call, Dr. Prasad doesn't have any idea what questions I'm going to ask him. He just has the topic just like you.
That's okay.
And so I'm very familiar with most of his research, so he knows I usually come in, fairly prepared, and I'm excited about that. But also so we want to be able to walk, talk, think, cognition. We want to be able to eat and assimilate. We want to be able to excrete, and we want to be able to heal. And those are some really fundamental things. And Dr. Prasad, is 88 years young.
That's right.
And, I mean, if whatever he's doing, we totally want to be just like Dr. Prasad. So that's what we did last week. And so this week, we're going to dive into his latest research now that he's finished his book on diabetes, which we're so excited. I mean, we know it'll take a little bit to get published, but now he is delving into the gut microbiome. And this is super important. And so let me see. So tonight, we did a little bit of that background last week, and now today we're really going into nutrients in the gut microbiome. I do have a couple of slides that I wanted to show real quick for people. And let me see. He's always surprised what I'm going to pull up because he doesn't know, but I think it's important. Here we go. Here we have. Can we see that? Here is the human digestive tract. And one of the things that with Dr. Prasad's work is that he made our foundational product, which is so important as far as reducing oxidative stress and inflammation simultaneously. But the new product of the actual probiotic boost is important for the assimilation of that product. Dr. Prasad, when I put this up, because a lot of people don't understand one of the unique aspects of the probiotic that you made is that it actually is pH and heat resistance. But when we look at assimilation, and how it starts in your mouth, and then when you look at the different pHs all the way through, it's really important when we start digestion that we actually chew our food. And so we can send signals, right, to our stomach to prepare for that. So why did you, your masterfully made probiotic, why did you choose to find, the suite of with the Bacillus coagulans to be able to make sure that it can handle this harsh environment in the stomach so that it can still get through?
Yes. No, as you know, first we found out that as you grow older, with or without disease, the intestinal flora changes in favor of harmful bacteria. And these harmful bacteria can generate a lot of pro-inflammatory cytokine, which is very toxic to all your organs, will be absorbed from your gut, and gut is not healthy. And so knowing that, and then we develop probiotics, and when I looked at the formulation in the marketplace that are being sold, I said they don't have any inhibitor, because these probiotics, if you take orally regular probiotics, 70 to 80% are destroyed in acid pH of the stomach, like you have mentioned. The stomach is very acidic. And so most of the product that were being sold was just had a strain of Bifido and Lactobacillus strain, and they are very sensitive to acid pH. And as you know, they reside in lower large intestine, part of the intestine. And so I think that, so then I found out my wife was taking a Bacillus coagulant. I said, what is unique? Because doctor recommended it. And so I said, well, doctor recommended just alone, Bacillus coagulant. And, but she has some minimal effect. But I found more about Bacillus coagulant, and then found that, yes, it is very acid resistance, because not only you have a stomach acid problem, but when you go to the intestine, it has bile acid. So it is a double. So you get another 10% or something get destroyed. So by the time you go to large intestine, there are only a few of them left. So, but when we found out Bacillus coagulant, then I said, is there any other strain that could be resistant and belong to a different class? And they found out yeast-derived Saccharomyces boulardii was another one, which also acid resistance and heat resistance both. So in our preparation, in addition to adding the classical one, Bifidobacteria, as well as the Lactobacillus bacteria, we added also two additional one. One was Bacillus coagulant, another was Saccharomyces boulardii. And these two have been shown clinically, it is safe and it is very effective in intestinal bowel syndrome, like you see with all kind of inflammatory bowel disease that we have. Many people have different types, and they are effective. And so that's why it is so important, because to maintain healthy gut. Without healthy gut, no matter how much micronutrient you are taking, it won't get absorbed adequately, and you will not get a maximum benefit. So it is very important to have a healthy gut, and diet is very important too, to maintain a healthy gut. If you do a lot of sugar, that will shift the balance of bacteria in favor of harmful bacteria. If you take too much fatty food, that will shift the balance too. So those kind of food creates a unnecessary imbalances in favor of harmful bacteria. So what we decided that we will have a probiotics, and so that maintains in a favor of beneficial bacteria, so that and when you take it, they go there, they will be destroyed some, but at least they are competing. In acid pH, we have also Bacillus coagulant and as well as Saccharomyces boulardii, and therefore maybe more number of other useful bacteria will go into your lower than if you take a pure Lactobacillus and Bifidobacteria. So this product is very unique. You don't find that in the marketplace, and a lot of people are getting benefit from there.
Yes, and you know what I love is that it's really masterfully crafted. And when you look at the back of the bottle, there are specific genus and species. And if you wanted to, like I did, I went through each one and you start looking at, certain ones are for the immune system and certain ones are for specific amino acids that are precursors for amino acids. It's truly masterfully made. And also the prebiotics, which are the food for the acid.
Very important.
What I wanted to show you is that a lot of people don't understand that we have a really big, and when you have a healthy gut microbiome and your digestive is really a tube from your mouth all the way to your anus, you really have different, when it's optimal, you have different pH. But what happens with this BIOS is that when you don't chew your food, right, we don't send the signals to provide the hydrochloric acid for your stomach, and your lower stomach, if you can see that, that's 1.5 pH. That's very acidic as a biochemist.
Yeah.
And so, but then it actually then goes into the duodenum, and it gets fairly basic. And then it goes back into the small intestine, and there's a range. And depending on the pH, that's the families, because nobody works alone, not in life and not in the gut microbiome. They like to work together, and they want to be in the same pH. So for everyone on here to understand, his product, by putting the Bacillus coagulans and the S. boulardii, it helps optimize this pH component. And for all of us to think about that piece, that it really is, it's really remarkable when you look at that. And when it's not in the appropriate pH, Dr. Prasad, then you have putrefaction, right?
Yeah. Yes.
And putrefaction means it's just rotting in there.
Yeah.
Okay, so this is really, really important. So I want to stop the share. So that's one piece of that. So with your research, one of the things that I came up with, we've been talking about like the hallmarks of aging. And so, and many aging scientists have come together, and there are 10 aspects called the hallmarks of aging. And the very first one, which we've covered on Team Serve on YouTube, the very first one is the dysfunction of nutrient sensing. Well, that's still like all a part of the food going in and the whole thing. But the eighth hallmark is actually having a healthy gut microbiome. And I thought that was really interesting. So 2 of the 10 are directly related to our digestion. And and I looked up one of the facts today. The gut ecosystem has long been ignored in medicine. And for everybody on here to understand, even though Dr. Prasad has been working on nutrients and polyphenols and all kinds of multi-micronutrient formulations, it is now like looking at the final outcome of looking at the fecal testing and the whole genome sequencing. We can actually see what genus and species families are working together in there, and almost every single chronic disease, Dr. Prasad, that I found, but I want to hear what you found.
Yeah, no, it is correct.
It's directly linked to the dysbios of the gut, whether it be cancer, heart disease, all kinds of allergies, mood disorders, diabetes, Parkinson's, dementia, and autism. So what has your research led you to? Like, because this is where you are, because I asked you last time.
I mean, that's the reason even in the diabetes or the paper that I written it, I emphasize the point that when you talked about aging with healthy lifestyle, and then you just cannot have just one factor. There are multiple factors, and collagen is one. You know, sometimes you say, is micronutrient is enough? No, it is good to start with, but you also have to collagen, because you are losing collagen as you grow older. So you have to take not only the skin and your appearance, but it is all over your organ, brain, all organ have a collagen. And therefore it is very important to have it. And then you have a probiotics. So at least these 3 components is extremely important. Is the micronutrient EMF, collagen peptides, and probiotics. And so I think for any aging person, and then if you are old and if you have eye problem, then you take an eye boost. If you have some memory issue, then you take an improved brain function and take brain boost. If you have some during aging, you have some anxiety or depression disorder, then you add also CBD. And so when you are trying to maintain a healthy aging while you are aging, then you cannot take one factor. But as you know, Jenna, most of the study on aging has been with one antioxidant. When you understand it, that this was such a dumb idea, but a lot of paper has been published on that, just one agent.
Well, and I think that's one of the most important things for people when you look at Dr. Prasad's body of work. It is a multi-micronutrient approach.
Yes.
And a lot of research was done on that multi-micronutrient approach on that one formulation. But one of the things that I also found, Dr. Prasad, is that a lot of our good bacteria really love polyphenols, like curcumin.
Yes.
Right? And that's in our product.
Yes, resveratrol. They love resveratrol.
They
And
do.
also, another thing is the uniqueness of the probiotics, that it allowed beneficial bacteria to grow more. And then this thing, as you mentioned, it produces some vitamin K. Yeah, you can see Dr. Cote is showing it. It produces some amino acids, some neurotransmitters. And not only that, it also produces what we call them short chain fatty acid, only 4 carbon, very short. And one of them is butyric acid. And as you know, butyric acid is a very powerful anti-cancer agent. Plus, it also very important for your whole well-being. So it is very important to maintain the balance in favor of useful bacteria, beneficial bacteria, to be healthy. If you ignore this, no matter how much collagen peptides and other things you're taking, this will help some, but it won't be as good as with probiotics.
What's so exciting, Dr. Court and I were talking on our 16-hour drive here. And I'm looking forward to her sharing her story on the goodies in just a minute. But one of the things we wanted to talk about, what are the symptoms of gut dysbiose? And this isn't, for people at home, and I started asking Dr. Court these questions, being in practice for a long time. I said, Dr. Court, what are some of the biggest symptoms you're seeing when people have gut dysbiose? Because, and so why don't we walk through, Dr. Court, what is some of the first things that we went from head to toe, like from top to bottom, So some of the symptoms Dr. Court brought up was like brain fog. And after they ate, they could feel some anxiety or depression because they're not digesting very well. I brought up acid reflux. I think a lot of people, we talked about this about 10 years ago, that as we age, we don't make enough hydrochloric acid. Do you know what I mean? So their acid reflux is one of the top over-the-counter medications on the market. And, that's something that I think is important. And Dr. Court, go ahead and work on some.
And food coma, I'm sure that we've all eaten something, or we've had a big meal, and then we just need to go to sleep. We just, it puts us out. Go ahead, Jed.
It's okay, like chest pain. If you feel bloated, like right after you eat, like you feel bloated or just uncomfortable, if you have constipation. And so Dr. Court and I talked about that on a couple different calls. Dr. Court actually put up the Bristol stool sample of what a healthy stool should be, because a part of the large intestine is to pull out the water. And so if you're not moving waste, then it can become really hard. So Dr. Court, how long have you been asking people, how often do they move waste, and what is a healthy bowel movement?
Well, I've been in medicine for 40 years. And so it was part of my intake when I was treating people on the ambulance, and it's been a major part of my intake as a physician for the last 30 years. So I've been doing it since I was like 18, asking people, how often do you poop? And it's always interesting to me that most people say, oh, I'm normal, and then I have to ask, well, what's normal? And they're like, oh, once a day or once every 2 or 3 days. And I'm like, that's not normal. But it's a great place to start with people, because if they're putting food in, have waste out, and if they're not getting the waste out, then they're actually using poop for energy, because if the fecal material continues to stay in there, would you agree with me on this, Dr. Prasad? If the fecal material stays in the colon's going to continue to try and pull nutrients out of the waste. Do you agree with that, or do you?
Yeah, but also that, even if absorption is not there, but some of the toxic chemical, if the things is not removed, some of the toxic chemicals which are formed during digestion of food, whether it's a meat eater or vegetarian, they can stay there and gradually get absorbed.
And we see this in people with autoimmune issues. They are extremely plugged up and blocked up. They, we had a patient that we actually had to go and several patients that would poop once a week, and have one bowel movement a week, and they were just so sick. I don't know if you can hear me with the wind blowing, but they were so toxic. and just you could see the life come back into them when they got their bowels moving in the right direction.
Right.
Yeah.
Well, even with Parkinson's, Dr. Prasad and Dr. Court, I know that they know years and years and years, way before other symptoms show up, before they lose their smell, they will have constipation. So it is one of those things that, like the work that the beautifully made product that Dr. Prasad has made. And so we start with the Microdaily EMF, which is the core multi-micronutrient product. And what happens when you get a healthy gut and you have healthy gut flora, then the Microdaily EMF works better. So then you even have more energy. It's just it's amazing. But one of the things that I love is that because I measure fecal samples, and I have for many years, and they used to just measure like for E. coli or a fecal sample or Clostridium difficile, but now they can measure like families of genus and species and how they work together, and which ones make GABA and which ones make histamine, and it's fascinating. And so if you just know that Dr. Prasad's work is very pioneering. And so, like we said, for many years, no one discussed that. So Dr. Prasad is writing a book on gut microbiome and his work. So I think it's so important because it's really, I think, one of the most complex pieces, yes, Dr. Court.
I didn't want to interrupt you.
Okay.
I wanted to throw in, I'm sorry. I wanted to throw in maybe having Dr. Prasad talk a little bit about Clostridium difficile. I don't know if you were going to get there, but.
Well,
what was that?
He wanted to know if you know much about Clostridium difficile.
No.
Okay. So it's an infectious disease, especially in the elderly, but we're seeing newer virulent strains in younger people. And it has very toxic neurotoxins A and B. And so people have high recurrences, and it's very serious.
It is a bacteria or viral?
It's a bacteria. And it's very, it spreads, it's a spore. So but I want you to know, by working on your gut BIOS, and having, with Dr. Prasad's Microdaily EMF and the probiotic and collagen, you can totally strengthen that, so you'll be more strong and resilient. So even when exposed, or if you've had it before, you'll be stronger. Because I want you to know, Dr. Prasad, I have seen a lot of the neurodegenerative issues with our patients, that they usually have out of normative range Clostridium difficile, and the neurotoxins are very toxic.
Of course.
So anyhow, with that being said, it's exciting that we have a strategy. But one of the things that Dr. Court wanted to share is the vagus nerve, and what happens when you are stressed out, right, Dr. Court?
Yes.
We went over this. Even when you're taking the probiotics and you're getting everything talking, what happens, Dr. Court, over a long period of time if people have an infection, or they have a lot of inflammation, or they don't sleep well? What happens to this vagus nerve, Dr. Court?
Well, Jonah, the vagus nerve, I think, is one of the most important of the cranial nerves, but all the cranial nerves, there's 12 of them. And of those cranial nerves, and as Dr. EMF, that I want to talk about our cellular hygiene and how it affects it. But the brain stem, right between your ears, that's where these 12 cranial nerves are located. And so when we look at the vagus nerve, just by holding your phone against your head, you're affecting the vagus nerve through the auricula of the ear, as well as the canal of the ear, and then down. That's cranial nerve 3. So we're going to go through the cranial nerves really quickly and explain how important this vagus nerve is and how it's affected by just our common usage of our electronics, but especially the phone. So cranial nerve 2 has to do with vision. And when we look at the screen and get blue light, that affects the vision. Cranial nerve 3 also has to do with vision. And it's actually pupillary reflex. And that's really important with blue light. Cranial nerve 4 has to do with hearing. And then cranial nerve 5 is the big dental nerve. So the big dental nerve is the trigeminal nerve. It's a massive nerve. Cranial nerve 6 also has to do with vision. Then cranial nerve 7 has to do with the tongue and the mouth. Cranial nerve 8 has to do with hearing and balance. All of these things are associated with where you hold the phone. Cranial nerve 9 has to do with your throat, and then cranial nerve 10 is the vagus nerve. And the vagus nerve, Jonette, we've talked about it numerous times. It has to do with everything on the way down. It affects the ear, the auricula of the ear. It affects, I believe I'm right on that, the throat, the pharynx. It affects the apex of the aorta, the heart, the lungs, the liver, the kidneys, the gut, the spleen, the gallbladder, all the way down. This one nerve. It's called the vagus nerve because it wanders everywhere from the center of the head down all the way to the tail to the end.
So Dr. Court, I wanted to, the next month, we're going to be going over EMF. So we wanted to bring us back to the gut part. And so with that, looking at this vagus nerve, which is the 10th cranial nerve, I know that it affects all motility. So if you're stressed out, okay, and you have an infection, it's not good to eat when you're stressed out. But what happens is that this vagus nerve is in survival mode and it's switched off. So we don't have motility of the small and large intestine and the stomach all working together. And we don't have blood flow to the enteric system and to the GI tract. And what happens, Dr. Court, when that happens over a long period of time, what happens to the person, even though they might start taking probiotics, that nerve is switched off. What are some strategies that you would help people so they can take the probiotic and then also get the vagus nerve turned back on?
Well, you know, in functional neurology, we're always trying to come up with ways that we can stimulate the vagus nerve. And so I've got 3 really simple ways to stimulate the vagus nerve. So one is by humming. And, you know, it's interesting. We were reading this morning, we were talking about the Sherpas. And one of the things Sherpas do is they do kind of an om. So doing a deep guttural hum will help to stimulate the vagus nerve. Another thing, when people have vagus nerve issues, is that they have trouble swallowing. And so another thing that's really good to stimulate the vagus nerve is actually gargling. And so I have people gargle with gusto, which is just to let it rip, wah, and gargle as loud as you can. And then this is a little more of an advanced movement, but if you don't have low back injuries or a low back disc condition, you can do this one. If you do, please don't do this, but actually gagging, taking a toothbrush or tongue depressor and putting it in the back of your throat and getting a very guttural gag is extremely good to re-stimulate the vagus nerve. However, if you have a disc herniation or low back issues, that big guttural contraction can actually cause a back injury. So please don't do it if you have back injuries.
Let's not do that.
Most people don't know that, though. Honestly,
no, I didn't know
people
that.
don't know that.
I have because of playing tennis and volleyball and everything, I have some back problem issue, but you know.
Dr. Prasad, you can hum, you can gargle.
Yeah,
can
that's good to know. Yeah.
Tapping's good.
Laughing is great. Also tapping, you know, where you tap on your stomach, tap with gusto on your stomach, but please don't do the gagging because that'll be
Okay, thank you.
Yeah.
Well, those are some things together with the probiotic, right, and the vagus nerve working. You can have optimal longevity even if you have had dysbios for many years of your life. This really is, and because the cells of the GI tract turn over very fast, right, Dr. Prasad?
Yes, and you can do it at any age. Really, it doesn't have to be nice to start early, but now we have started. These are all recent information, so you can start at any age and still feel good about it.
Yes.
I particularly use the humming when Jonette's mad at me. So
that's Om is very classical Indian humming.
Okay,
And he's out there so he doesn't get slapped.
that's true. Okay. So we're gonna actually do an interview with my very good friend Dolores Beiersdorf. And
Sure.
how long, this is a part of our goodie series, okay, which is our over 70. So Dolores, let me see, how many years young are you?
In 1 month, I'll be 79.
So she's 79 years young.
That
How
looks
many-
very good.
She does. So how many years have you been on Engage products, the Micro Daily?
Since it first started. So it's 7 or 8 years now, I think.
Yeah, so about 8 years. So we started together.
Oh,
Yeah. We
wow.
drove to Utah together because
12 hours we drove.
we did, and with a very smart nurse. So we had a farmer. So I'm going to introduce Dolores. Dolores is one of the smartest people I've ever met on the planet. She grows food. She has for many years. She reads soil samples. She works with many farms, very large organic farms, to solve problems. She solves all kinds of problems. Her passion is to educate people to grow healthy food without any sprays. So she knows minerals, and she knows a lot about nutrition. Been on the planet a long time, but you know what? Why have you chosen this product? You've looked at many products on the market. Why have you stayed on this product for 8 years?
Both of us looked at the label and said, okay, what is this any different? But it was taking it and seeing the response and seeing other people's responses to it that really made us see the difference. And I have many, many health issues. 117 defective liver genes is a start. And oversprayed by a spray plane, had plastic poisoning, almost died. Many, many, many challenges in my life. And I was diagnosed in my 50s with a 35% lung capacity. They had thought I had been a smoker, and I said, no, I'm an anti-smoker. Or how would I say it? Anyway.
35%, you only have 35% lung capacity in your mid-50s.
Early 50s.
Mm-hmm.
And this is when I started trying to find my biological family, because I was adopted, and where in the world is this coming from? And anyway, so, they eventually had me on a CPAP machine, and, I was gasping all the time, just energy level is low. And so we ran our genetics a little before we got on the Micro Daily. So 19. Probably 9 years ago or so, we ran genetics and found out how to help myself. But when I got on the Micro Daily, I had been on a CPAP machine, and 4 months, it took me 4 months, and this is the basic Micro Daily, and I startled myself awake because I was breathing so deeply that it was like, what's going on? What's happening? And that was the beginning. It was just amazing to be able to take a deep breath after all those years.
So hang on, you were mid-50s, and so that was 15 years.
It's 20 years.
20 years of having 35% lung capacity, having a CPAP, and what she told me is it felt like breathing through a straw. Is that her for the 20 years?
And they put me in that tube at the hospital, and they tried every single medication to try to make me breathe better. And there was zero response with every single medication, because they tried inhalers. They said, all those things do is make me sick. And there was no benefit for any drug, but Micro Daily made a huge difference.
So after 4 months, she said, I don't need the CPAP, and I can breathe. And so it brought everybody to tears, because her lungs in 4 months, and now, okay, so that was the first part of her benefit story for you to be on. Everyone knows that after 8 years, so that was her first part of her benefit. And we only had one product. And I mean, it changed her life. And she loves people. She loves educating people about healthy food. If she wouldn't have been so committed to her health, she wouldn't be here. No. Really. So Micro Daily has been foundational for her. Then we've added in, the collagen and the probiotics. Let's talk about where we are now. With those products, what do they have done for you?
The probiotic really did make a huge difference. I've been growing my own food. I do my own yogurt, all these things for my life. Otherwise I wouldn't be here. But having that probiotic really did make a difference. And you don't notice it right away. It's kind of a gradual thing. You're going, things are working better. you just feel like things are moving out of your system. And the collagen too, that was kind of like, meh, but it dissolves really easy in warm liquids, and it doesn't have a nasty taste, because I go, oh, this is really ugly. And it just does a lot of good things for your body. You feel firmer, and things are tightening up, and it's wonderful. I just love the combination, and don't ever want to be without it. I just, the probiotic really, really gets in there and really roots out problems, because I was raised on cow's milk. I'm deadly allergic to it. I've had gut issues since I was an infant. And so here I am, going to be 75 years old and getting better. That's pretty nice.
That's good. That's very good.
And her and her husband, like, they moved their farm from Washington State, Dr. Prasad. They're
2,000 miles.
2,000 miles to the Ozarks here in Missouri. And they have cows, and they did it all themselves. They grow everything themselves, and goats, and it's amazing. But I want you to know, they are very active, hardworking people. They don't have anybody helping them here. She has the energy to do her passion, to grow her food, to educate people on how to grow food. And she shares Micro Daily with everyone here. And so
that's great.
So Dolores, with that, if you could share with anybody on here, maybe hearing about the product for the first time, it's been 8 years, what would you say to them to give it a shot?
Everybody needs to do this, because the food out there, I grow the best food. Okay. There's no doubt about it. But the food supply is adulterated. It is inefficient. When you have all these gardeners online, oh, I've got this insect problem, and I've got this, and they're spraying it with this and spraying with that, the nutrition is not there. A healthy plant doesn't have insects. And so the quality that they're eating, the air, the water, everything else, everybody needs to have some nutritional support. Otherwise, we're never going to make it through this.
Yeah.
And daily, they're mandating more things. Like, you just sent me that thing on vaccines for hogs, because they do GMO grains, and they have gut viruses all the time from it. And so, we need more control over our food supply. But if you can't do that, then you certainly need to do something to help yourself with the nutrition. It makes a huge difference.
And I think for Dolores, Dr. Prasad, and everyone on here, she really grows food, and she's been working with microbiome, and and growing that in the rhizome is really where all the nutrition is. And that's what she's worked on for years. And so she's an agronomist. She's studied under Dr. Tanio. So it's like she taught me, it starts with the root, and it's the micro in there. And that's really the same as our microbiome, right? And really, and so together, like, she is really truly one of the smartest people that I've ever met. And you know what? She grows the very best food. And so if anybody wants to learn more about how to do that, she's your gal for sure. But
and you can neutralize any toxin with the beneficial bacteria in the soil.
Yeah.
And adding the right minerals.
Yeah.
And we bought a farm, 110-acre farm. And after purchasing it, this person comes by and says, they spread out 27 acres of that so heavy you'll grow nothing. And I was not a happy camper. First of all, that's against the law not to disclose. Second of all, it's a bunch of chemicals. And because the guy really upset me a lot about how difficult this was going to be, I did a test plot. And normally you apply microbes spring and fall. But because of his attitude and what he said, I did it weekly. And
with microbes.
Yes, weekly.
With microbes.
I did a garden plot, and I did it weekly. And I had vegetables and fruits that were enormous and fantastic. And I only had a few melon plants, and we had another family, working off that garden. And when it said it was going to frost, we filled a half-ton pickup truck bed with melons. I had corn 14 inches long with every single kernel field. I said I'd never seen that in my life. I had broccoli the width of my shoulders. I said, a family of 8 with that one broccoli head. I started selling it to the health food store because I had a number of those. And I said, what in the world are you going to do with that rich broccoli?
And what's so exciting is that Dr. Court and I are here to get to enjoy this food and spend time with them. And I'm so excited.
Great.
So,
And
Miss-
I have to tell you about the boron research because this is so fascinating. Nobody could tell me the upper limit of boron. They say, oh, too much boron will sterilize the soil. But what if too much? They know the minimum, they don't know the upper limit. So I started playing with boron and I planted peas in my greenhouse and the peas came up like a fan. And I'm going, I know I put one pea seed there. I did it one at a time and it grew in this fan. And I thought, well, that's really fascinating. So when I did the beans, I spread it out a little further thinking they would do the same thing. No, they did not. They went single stalk about 5 feet up. And then at every joint, it went sideways. So that bean plant ended up being 17 foot tall and 14 foot wide. And
Good experiment.
And I said, isn't that totally fascinating?
yes, so she challenges everyone, kind of like you, Dr. Prasad, like what is the upper limit of boron? Because she tests the soil, so she knows.
Exactly.
Yes, very interesting.
Boron is really, really important because it is what assimilates calcium. And then all the other trace minerals right on the back of calcium. So if you don't get those two ratios correct, nothing else is happening.
Yeah.
And so many people do not.
She's experimentalist.
Yes.
Plant. Yes, she does experiment. Yeah, that's very nice.
I've always challenged the norm since I was a child.
That's the good one.
Yes.
That's the good character.
If they say it's the gospel truth, I say, okay, let's see if that's the gospel truth, because there's so much knowledge out there that is really not knowledge. It maybe it's old knowledge, maybe it doesn't pertain today. There's a lot of things that you have to challenge that today.
Yep.
And see if it still works.
Is this your email? I'm putting Dolores's email in there if you'd like to contact her for a soil sample or some knowledge on how to grow food. So is it Lady Farmer?
LDY, spell out farmer @gmail.com.
Okay. So I put that in there for you guys if you'd like to reach out to her. She's amazing. And you know what? 8 years on product and she's not getting off. And I want you to know her and her husband, he's also a veteran and a helicopter pilot.
Oh, I got to tell you, John just had his physical and they said, the lady checked his heart twice. She said, you have a heart of a 30-year-old. You're how old? And that's pretty incredible because he's a Vietnam veteran, coded in Agent Orange, has had numerous issues here. And his heart is like a 30-year-old.
And he's been on Micro Daily for 8 years.
Yeah.
That's amazing.
And you know what, Dr. Prasad, we never
I think,
tire.
tomorrow we have a veteran nights. I think you should bring her.
I know. And she
Yeah,
used to work for the VA, so she knows they need it so badly. Yes,
Yeah.
Dr. Court. Go ahead, Dr. Court.
I was going to say, how old is John? Because we'll have to do him on the goodies program too.
He's
He's
77.
77.
77. And how many trips did he make from Washington to Missouri? Because I just
my
made
goodness.
one and I'm exhausted.
Oh, at least a dozen.
Towing trailers and equipment and all kinds of things. It's beautiful
All
here in the
the
Ozarks.
farm implements, the goats, the cows, the whole thing.
Exactly.
But I really wanted Dolores to get on to really talk because she really understands the soil and the microbes. And it doesn't even matter where the soil's, if it's acidic or alkaline, the microbes can take care of the toxins and they can correct that. And I just really thought it was fascinating, like the same for us.
Janet, Bacillus coagulant was isolated from soil.
I did not know that.
It is not naturally present in a. So sometimes through the food we eat or something like that, but actually they were purified and isolated from soil.
But the soil bacteria is what we're made out of.
Yeah.
There's just so many things. I mean, that's why Jonette and I've gotten along really well, because I understand everything that happens in that soil and understanding the mineral balance, how everything has to be in the right ratio to something else.
Exactly. That's what is true for human nutrition as well. I mean, microdaily or everything.
Overdo one thing, you're going to throw the whole thing out of balance. And people don't understand that. Veterinarians don't understand that. Doctors don't understand that. And balance is all that we talk about, because if it's balanced, it's going to work. And it doesn't, balance means some things are very tiny, like boron is 1.5 parts per million to 2 parts per million. It's not pounds per acre, it's parts per million. But
Yeah.
calcium is 75% of your soil profile. And then people look at magnesium and say, well, magnesium is really important, it should be higher. That is a 7-to-1 ratio. If you don't have that ratio right, you have got gook. You have that stuff that sticks to your feet, nasty clay. But boron is what activates that calcium. Here we have low boron. You put the boron out there, the calcium works, and then the soil works out, and everything is wonderful. And insects. Potato bugs were probably the only thing I really had an issue with when I started learning biological farming. And the gentleman at the seminar said, oh, I oversee 1,000 acres. We don't have to use any pesticides. I'm going, how? And he wasn't going to tell me the secret. What he told me was the pH, not the pH of the soil, the pH of the growing plant.
Interesting.
And how do you make it right by the balance of minerals? So I figured out a shortcut. So when you have squash bugs or potato bugs or those kind of things, you're not getting the calcium in there. So you can do a calcium foliar and in 2 hours you have no bugs. How simple is that?
Yeah.
So
If you have aphids,
That's
you
good.
put boron and they're gone because it's a boron deficiency for aphids.
you know what? The two of us, like, we'll be here for hours. Yes,
Yeah.
Dr. Court.
I just wanted to say that. I mean, I'm sitting here listening to the longevity series, and I'm absolutely cracking up inside because we have Dr. Prasad at 88 now plus, and we have Dolores at almost 79, who's just moved across the country and moved her entire farm across the country because she wanted to be in the Ozarks. And then we have Jonette. And, you know, folks, this is the battle of the minds. And this was so much fun to see it and be a part of.
I want to end. Thank you, Dr. Court. I want to end with this. Everything is about imbalances, right, Dr. Prasad?
Yes,
The work
yes.
that you've done in the soil and growing food, and Dr. Prasad, like, we understand and honor like your work. We want you to know, like, she was there for me, like, during hard times with my breast cancer, and just such a great friend to me. And I have the best food and support. But I want you to know, like, Dr. Prasad, your life's work is so important to so many. And this call, for people that get to see it later on YouTube, just know he is sharp as a tack. I re-listened to when these calls, and he never says he's pulling like all of this research and work, and it's so much, the body of work. So I want to thank you, Dr. Prasad. It really is truly, like,
Thank
it
you.
is one of my greatest honors of my life to get to be a part of this dream team right here. Go ahead.
Without this, Micro Daily would be still lying in my lab. Without you and Dr. Court and all the people who are participating in this meeting.
Well,
I thank all of you.
Yes, go ahead, Dr.
You know,
Court.
we had the military formula, and now we have the EMF, the
My
enhanced
EMF, yeah,
formula,
evolution,
the evolution.
gradual
Yes, this
evolution
has
of that.
been an evolution. And, you know, the first formula was designed to protect us from radiation, biowarfare, and extreme stress. And this formula continues that, but also helps with non-ionizing radiation,
Exactly.
biowarfare, and
So
extreme
EMF
stress.
was developed because of your interest in EMF, really. Otherwise, we had no intention of changing it until you brought up this issue. And then I said, okay, let me look into it, you know. So I
that
thank you very much.
conversation.
And Jeanette too.
And then, you know, what I'm trying to get here is that food is critical, but
Of
our
course.
food is always not as good as, for instance, Dolores's food. And so we need nutrients, these specific nutrients, to be able to carry us through so that we can have the longevity like both of you. I've
Yes,
seen the
indeed.
miracle of Dolores. She used to come into my clinic, and I've seen how much she has changed, and literally watched the hands of time be turned back so that she could do this miraculous move.
And
Because it's
sharp.
not, and so sharp. I mean, listen, this conversation has been amazing. So
Yes.
the most important things, Dr. Prasad, you had mentioned that in the beginning of the call, and let's just go over it again as we're getting ready to run out of time here. But the EMF formula, absolutely critical.
Yes.
the probiotic formula.
Yes,
and-
absolutely.
And the collagen.
Peptides. For aging, all these things happen. Even in aging, if you don't have any disease, still the intestinal flora will change in favor of harmful bacteria. So old age, with or without disease, it happens. So it is very important, probiotics. And most of the pharmacologists don't pay any attention to the intestine. They are interested only what goes on in the blood. So they run all the profile, what is happening in the blood. But the most important thing happening in the gut. Without that, what we are going to do? all the data you get in the blood would be abnormal. And if the gut is not happy, then whatever being absorbed or you are measuring it will be totally erratic.
Yes. Fantastic. Well, we're coming up on the hour. And so I know Dr. Prasad, with the Octo Longevity Series, I proposed a topic for next month, which
Okay.
we'll be getting soon. And as we're preparing to share more about EMF basics, hypersensitivity, and and really educating people on how to, this is about protecting yourself from the inside out. And that's really what these suite of products do. And I think, Dr. Court and I have been measuring, in closing, we've been measuring individuals that have different types of symptoms, some very severe, such as having seizures if they get near someone's cell phone.
Yeah.
They're very severe, but I want you to know, when you have the building blocks, both with the microdaily EMF and the collagen and the probiotic, your body can start protecting and becoming resilient, like Dr. Court. And so I just want you to know on this, I look forward to next month's series. I think it's going to be great. And is there
not only acute effect of EMF, but also you have to be concerned about the late effect, which is as important, because especially children, like Dr. Court says, they are much more sensitive. So you have to protect right now at any age. But for especially for children and young adult is very important, because they are going to live a longer time, because these manifestation of the late effect takes 10, 15 years.
And there's hope.
There is so much hope for everybody.
There's hope for everyone on the call, because
exactly.
Jonette and I just drove 15 hours.
Yeah.
And we drove. One of the things that has affected me the most is being in the confined spaces of a vehicle and having someone with their phone on. And we drove the entire time. Of course, she's reading to me. Of course, she's teaching me the whole time. She's been my tutor forever. And so she's just on her phone. And we did great. I mean, we didn't have any real significant issues with that. And I think that that's the cumulative effect of the microdaily, the probiotic, and the collagen. And when I did start feeling a little bit affected or functionally impaired, she gave me a hydro. And so that was the bump that would keep me going to be able to drive like that. And we drove it in just 2 days. So
yeah, and a hydro is so easy. And now some people are taking a gummy, a couple of gummy, they take it.
We're gonna go ahead and sign off. And so everyone, for the people that were on this call, get back to the person that invited you to get on this call tonight. And we know it'll help you so much. And just get started. And you know what? Every red blood cell is brand new in 90 days. So just make that commitment, and we know you're going to get better. So Jeff, if you want to go ahead and hop back on, and I know people want to say goodnight to Dr. Prasad and go ahead and cut the actual recording, we can end the call.
Good.
What an incredible evening. Oh my goodness. I've just been sitting back here and thinking that very first time I met you and Dolores at the same time, just back several rows at an event that we had there in Salt Lake, when it was actually in Orem. But pretty amazing to see what has transpired since then. And it's just been a joy to be here and to have Dr. Prasad come